Presentation on orthopedic impairments done by Peter, Alex, and Mia. In this presentation, we'll go over the definition of an orthopedic impairment, certain causes that may go into an orthopedic impairment. I will go into the types of impairments that you would see in your classroom. We'll also talk about how this can affect student learning and some accommodations in the classroom that you can put forward. We're also going to go over assistive technologies that teachers like us can have in the classroom. And lastly, we're going to talk about eligibility of this.
An orthopedic impairment is defined by the Individuals with Disabilities Education Act, or IDEA, as a severe orthopedic impairment that adversely affects a child's educational performance. IDEA specifies that this term includes impairments caused by congenital anomaly, impairments caused by disease, and impairments from other causes. An orthopedic impairment is a severe impairment caused by issues with the bones, joints, or muscles, and can be caused by a number of things. Many children with an orthopedic impairment do still have normal cognitive abilities, so these children require mainstream education wherever possible and in the least restrictive environment as appropriate. Orthopedic impairments can be classified as belonging to one of three different categories. The three categories are neuromotor impairments, degenerative diseases, and musculoskeletal disorders. A neuromotor impairment is an abnormality of or damage to the brain, spinal cord, or nervous system that sends impulses to the muscles of the body. These impairments are acquired at or before birth and often result in complex motor problems that can affect several body systems. Examples include spina bifida, cerebral palsy, and a spinal cord injury. Degenerative diseases are composed of various diseases that affect motor development. Examples include muscular dystrophy and spinal muscular atrophy. Musculoskeletal disorders are composed of various conditions that can result in various levels of physical limitations. Examples include clubfoot, missing and deformed limbs, scoliosis, as well as juvenile rheumatoid arthritis. How does an orthopedic impairment affect learning? This may interfere with a student's ability to walk, write, communicate with others, respond to questions, and pay attention in class. Other academic barriers for students with an orthopedic impairment include non-accessible transportation, like school buses, trouble maneuvering around the hallways and classrooms, especially when it is densely packed or there is not enough room to pass by, and this also includes earning the mandated physical education credit for participation.
Some classroom strategies for accommodations could be as simple as planning ahead, which would provide time for the teacher to know if there need to be greater changes, like providing skeleton notes or other tools, as well as check-ins, which can provide the opportunity for students to share any possible concerns they might have with their teacher. Other classroom strategies include writing aids, like providing speech-to-text technology, special writing tools like pencil grips or special paper, and including extra response time. It also includes a specific classroom setup that provides space for students to navigate the classroom in terms of wide gaps and adjustable seating and desks, as well as preferred seating. Assistive technologies are great tools that allow the students to access the information in a way that's accessible to them. So this can include speech-to-text technology or voice recognition technology, as well as adjustable seating that can be moved around the classroom or adjusted to their height, as well as modified keyboards for their usage. Some other tools or assistive technology that can be used within the classroom include electronic pointing devices or reacher tools, which would help students reach things that might typically be out of their grab or their space, as well as adaptive equipment for physical education, which would be within gym classes or also regular classes.
For the next area, we're going to be talking about eligibility. Basically, there are two categories for eligibility, one of which is physical and the other which is academic. For the physical side of things, it would be assessed by a doctor or a physician. And the three categories that go under the physical eligibility, one of which is congenital anomaly. An example of this would be clubfoot or the absence of some other member. The other category would be impairment of disease. An example of this would be something like bone tuberculosis. And the last category would be other causes. Some categories that would fall on this is cerebral palsy, amputations, and fractures or burns that cause contractures. Moving on to the academic criteria for eligibility. This would be assessed by a physical or occupational therapist to see if a student would need certain accommodations in a classroom in order to help them better succeed in their learning. Some of the categories in this is a lack of meaningful and productive participation. So an example of this would be if a student is disrupting class and not even trying to pay attention. Another category would be reduced efficiency in schoolwork. This would fall under the category of failing to do homework or not trying in class group work. And the third category for this would be the inability to assess educational environment despite environmental functions. And then a third category I'd like to add is exclusionary factors, and this would be if a student falls under the physical criteria or academic criteria for eligibility, but they fail to meet the adverse effect is from lack of instruction in reading or math. So basically, if they are not doing as high in those, but they still have the criteria for something else, they're still unable to get it.